I have decided to do my final community health presentation on hoarding disorder and compulsive hoarding. By the end of this video, you should be able to define hoarding disorder, identify risk factors, signs, and symptoms of hoarding disorder, along with ways to treat hoarding disorder and potential complications. So what is hoarding disorder? Hoarding disorder is a persistent difficulty with discarding or parting with possessions because of a perceived need to save them. Many people with hoarding disorder feel distress at the thought of getting rid of their items. They feel their items have value that others do not feel these items have. Their collected items set them apart from other people in their mind and may cause potentially disabling problems characterized by the accumulation of excessive clutter to the point where their home may be obstructed and may not function as a home anymore, not only for the hoarder, but for those who also live in the hoarder's home. Hoarding cases range from mild to severe, and some may not affect an individual's life very much. Signs and symptoms of hoarding may include excessively acquiring items that you may not need or for which there is not space. Persistent difficulty throwing away items or parting with them is another sign or symptom. Feeling the need to save items and being upset, even emotional, by the thought of discarding these items. Building up clutter in the home to the point where rooms are unusable is a serious consequence of hoarding. An example of this would be a kitchen that was no longer able to be cooked in and dishes were no longer able to be washed in. Another example would be a bathroom that is no longer able to function properly and the toilet and shower and tub are no longer able to be used. Lastly, having a tendency towards indecisiveness, perfectionism, and procrastination coincide with hoarding. Hoarding can lead to disorganized piles and stacks of items throughout the house. It can also lead to possessions that crowd and clutter your walking space and living areas. Spaces become unusual for their intended purposes, as was just detailed. Buildup of food or trash and unnecessary unsanitary levels of filth in the home tie in with the rooms not being able to function the way they could before. Significant distress, problems functioning, keeping to yourself, and keeping others away from you, feeling that you are safest in your home, is a significant consequence of hoarding. Conflict with others who try to remove things from your home, trying to help, or feeling they are helping. And difficulty organizing items is another consequence of hoarding. Why do people have such difficulty discarding these items that may seem completely useless to the rest of the world? These items hold a significant, sometimes emotional or financial value to them, as perceived value can be altered. Hoarders believe their items are unique and that they will be needed at some point. The items have significant emotional significance and if thrown away, the hoarder can become very emotional and break down. People often feel safer when they are surrounded by their things. Often, hoarders feel they are being wasteful or ungrateful if they throw something away. Commonly hoarded items may include newspapers, magazines, paper and plastic bags, including shopping bags, cardboard boxes, photographs, household supplies, food, clothing, and animals. Animal hoarding can be a very specific type of hoarding, and often animals are found in disarray, without medical treatment, and malnourished. It is not uncommon for an animal hoarder to actually have dead animals in their home, and it is important for family members to intervene. Local authorities, including Adult Protective Services and Animal Control, may need to be called. Risk factors of hoarding usually start around ages 11 to 15 and get worse with age. Risk factors include personality types such as indecisiveness. If a member of your family has hoarding disorder, you are much more likely to have hoarding disorder yourself. A stressful life event that caused unresolved trauma is often a precursor to hoarding. These events may include the death of a loved one, divorce, or losing possessions in a fire. Hoarding often ties in with other mental health disorders such as ADHD, bipolar, and depression. Hoarding can affect physical and mental health by causing an increased risk of falls due to the debris and clutter around the house. An injury of being trapped by shifting or falling items is also common, as items can avalanche from the area they are with any shift of weight. Family conflicts are common among a hoarder. Loneliness and social isolation is common. Unsanitary conditions can pose a risk to health, and often the hoarder does not bathe and is not nourished as much as the average person. Hoarding is a fire hazard. It often leads to poor work performance and legal issues such as an eviction. Psychotherapy is the best form of treatment for hoarding, as there are no medications currently available to treat hoarding, aside from treating coinciding psychological issues. Psychotherapy is also called talk therapy. It will focus on learning to identify and challenge thoughts and beliefs related to acquiring and saving items. They will also teach you to learn to resist the urge to acquire more items. Learn to organize possessions and help you decide which ones to discard. They will also help you improve decision-making, coping skills, decluttering your home, reducing isolation, enhancing motivation, attending family or group therapy, as well as having periodic visits to help continue your therapy process. For more information on causes, symptoms, side effects, and potential treatments for people who have compulsive hoarding and hoarding disorder, please see these resources.